So today I'm going to be talking about integration and reimbursement methods for complementary and alternative medicine, also known as CAM or holistic medicine. Um, there's been an insurgence in the need for complementary and alternative medicine. Many individuals have begun to understand the importance of possibly using natural remedies over using medical ones. By medical, I mean like pharmacology, so the drugs and constant and chemotherapy and things like that. So um, as a healthcare professional or healthcare manager, it's important to understand how this affects you as well as how it affects your patient. There are some reimbursement methods for CAM, but they're limited in who uses it. A lot of managed care organizations are not aware or choose not to use these therapies, or if they do, they use it in limited capacity, such as midwifery and things like that, because it is extremely hard to find a way to get compensated for these reimbursement and receive reimbursement for these therapies, because it is not regulated. There is no formal regulation. There are no formal standards on what can constitute a complementary or alternative therapy. So with that in mind, it has become difficult for individuals in our capacities as healthcare professionals, healthcare managers, even if you're an insurer for a managed care organization, it's become difficult to find that so that you can be able to be reimbursed for these practices. So just to give you a little information about what complementary and alternative medicine is, they are the therapies and practices that make up a not medical type of care. And by that I mean it's not a standard care. There's no. Hello. So today I'm going to be talking about integration and reimbursement methods for complementary and alternative medicine, also known as CAM or holistic medicine. There's been an insurgence in the need for complementary and alternative medicine. Many individuals have begun to understand the importance of possibly using natural remedies over using medical ones. By medical, I mean like pharmacology, so the drugs and constant and chemotherapy and things like that. So as a healthcare professional or healthcare manager, it's important to understand how this affects you as well as how it affects your patient. There are some reimbursement methods for CAM, but they're limited in who uses it. A lot of managed care organizations are not aware or choose not to use these therapies, or if they do, they use it in limited capacity, such as midwifery and things like that, because it is extremely hard to find a way to get compensated for these reimbursement and receive reimbursement for these therapies, because it is not regulated. There is no formal regulation. There are no formal standards on what can constitute a complementary or alternative therapy. So with that in mind, it has become difficult for individuals in our capacities as healthcare professionals, healthcare managers, even if you're an insurer for a managed care organization, it's become difficult to find that so that you can be able to be reimbursed for these practices. So just to give you a little information about what complementary and alternative medicine is, they are the therapies and practices that make up a not medical type of care. And by that I mean it's not a standard care. There's no, as I said before, there's no formal training for these things. There can be training for these different therapies and practices, but there's no training in schools of in medical schools, and it's limited to what they train. Like there are some schools, like I see these schools that do look at the whole person and are really focused on more holistic alternatives and holistic medicine. But again, those are limited in their capacity to what they can teach, and because they don't understand everything, and so there has to be more research on the efficacy of all of these different therapies and whether or not they're truly beneficial for the patient. There should be a more synchronization in healthcare, so we should be more willing to work together as healthcare professionals and individuals to bring that standard of care, but also bring alternative care to the patient if it's needed. There are herbal supplements that have become popular recently, not just herbal supplements such as marijuana, but also herbal supplements that like corn oil and things like that, and tea tree oil that help to promote, better health, promote better skin. The IC fruit, hopefully I'm saying this correctly, IC or acai fruit is really good at promoting weight loss, promoting good skin, hair growth. Same with coconut oil and things like that. So there's become a need, and there's more usage of these things in mainstream society. There are many people, especially consumers, who are using their own money to purchase these things, and so because of that, that's another reason why it is becoming more difficult to receive compensation for those practices. As I said before, as healthcare professionals, we must try and understand these things instead of work against it. So I think it is best to talk to our patients about, the possibility of performing these type of therapies, or see if they already have these type of therapies outside of the medical office or the healthcare organization, because many people do practice other things, than just coming to the doctor, getting a diagnosis for what their disease or illness is. Many of them like to go an alternative route so that they can be able to possibly do these things at home and not have to come out of more money. I do believe that if we do begin to incorporate it even more so in our healthcare and in the healthcare system, we will most likely be able to find a way to regulate it and standardize it so that not only will we receive reimbursement, but we will also be able to have these standards in place so that there's a fewer incidents of death and misdiagnosis or mistreatment because someone received care outside of their normal healthcare professional provider, and this care somehow affected them to the point where the care that we provide for them was not good or mal. So some challenges that CAM therapies face are, the potential risk to the patient, but also the fact that it is extremely hard to, I don't want to say extremely hard, but it's extremely hard to, or difficult for other healthcare professionals such as doctors, nurses, PAs, and all of those other healthcare and allied health professionals to become more familiar with this type of therapy or this type of medicine. So it has to be an open thought. Someone has to come in and, be willing to work to find those methods that would work for the patient, and be willing to not only just stick to their same way of thinking or their same way of treating the patient, but be willing to be open to the idea of possible and alternative methods. As I said before, reimbursement can be difficult, but it is not impossible. So as I said, some managed care organizations have found ways to be reimbursed for these, and that includes through, a really familiar one that we are all aware of is chiropractic therapies, as well as acupuncture, midwifery, um, some herbal therapies, aromatherapy, and even nutritionists and dietitians. That is a form of complementary and alternative medicine, because you're not using any type of medicine, or you're not using any type of drug. They're just being informed of how to eat properly and how to do these things. And so that is extremely helpful, not only to the patient, but it can also be good for the insurer. So some other challenges that CAM may face includes, possibility that insurers don't want to be liable if the therapy doesn't work, or if and insurers are also afraid of, that there will not be used, that the products and the therapies won't be used, and that since there is no standard of what this care is, and what's good and what's not good, that can prove to be really dangerous for not only the patient but also for healthcare professionals, no matter what capacity you're in. And so we don't want to open up ourselves to malpractice lawsuits and things like that. That's why I do believe that in order to understand these therapies more, we must begin to do more research on what they may all entail. And by doing that, if we begin to incorporate them into the healthcare system and incorporate them into, because like I said, it has been done before, but continue to incorporate them into the healthcare system and teach them more in the medical schools and osteopathy schools, dental schools, whatever the case. This would allow for there to become a standard to reach, so that there aren't patients that are ending up dead, or patients that are ending up, worse off than before, because they are doing these other natural remedies outside of their normal health care. But like I said, it's not always a safe route. Complementary and alternative medicine, it's described sometimes as being really natural, and you can't be harmed by certain things, but that's not the case, because it does include, besides for the products, like natural products, it also includes some therapies that may not be considered safe under medical guidelines. But it's kind of like an if or thing. It's a balancing act, because sometimes it works, sometimes it doesn't. So, and that's even with regular medicine. With what's considered regular medicine or normal healthcare, sometimes these things work, sometimes they don't. So that's why it's important to find that standard of care for complementary and alternative medicine, to hold it up to a certain type of regulation, or fines, or even create a regulatory board, so to measure what to measure what can affect the patient, and not only affect the patient but affect healthcare professionals and healthcare organizations.